Applied Prevention Science International presents Prevention Portraits, a series of informal interviews with scientists, professionals, and other stakeholders who are contributing to prevention knowledge and practice around the world. We hope to bring you closer to their brilliant careers, experience, and professional paths in the prevention field. On behalf of APSI, thank you for joining us. Enjoy.
Hi, everyone, and welcome back to Prevention Portraits. My name is Maria Luna from APSI, and together with our president, Dr. Zilis Loboda, we want to welcome Dr. Douglas Coatsworth. He is a Betsey R. Endowed Professor in Behavioral Health and Associate Dean for Research in the College of Social Work at the University of Tennessee in Knoxville. And he's also an APSI member of our Scientific Advisory Board. Welcome, Doug.
Thank you very much. It's great to be here with you and to see you again.
Of course, and thank you so much for agreeing to talk with us today. To get started, why don't you tell us a little bit about your work and your profession and everything that you've done, or what you want to share with us on your work in prevention?
Sure. So I came to prevention in a little indirectly, I think. My degree's in clinical psychology, and I always thought that I would be a clinician and a researcher, but I didn't feel that I was a very good clinician. But I always wanted to have the opportunity to shape interventions with children, youth, and families. And prevention science provided a great opportunity for me to do that. I did a postdoc at Arizona State with a great team there with Erwin Sandler and Charlene Wolchik, working on an intervention, learning about prevention and how it differs from treatment and interventions. And then I was able to take that knowledge and work in a couple of different areas, focusing on family-based interventions primarily, and family interventions to strengthen parenting, strengthen family relationships, and to prevent problem behaviors in adolescence. So I've been doing that now for how many years? 30 years now. 30 years now, Zilly. 30 years.
I know.
Yeah.
It's amazing. You've done a lot in the field, Doug. We've been asking everybody we're interviewing about moving into prevention, and you mentioned how you did that. How did you feel about that? Were you comfortable with that movement? I mean, many of us have track in our mind that, this is how I'm going to do my career. I've get my bachelor's degree and my master's degree, and go on for a doctorate, and I have this path that I'm going to follow. And many of us are diverted for lots of reasons. And what led you to Arizona?
So I got my degree in clinical psychology at the University of Minnesota. And while I was there, my research experience was with two people who were very influential in my career, Norman Garmezy and Ann Maston, who had a project there called Project Competence. And they were studying the development of competence and resilience. And so I got very interested in positive aspects of life and development in contrast to the clinical side. And so for me, it was a natural transition into prevention programming, because I think the underlying models of prevention are really promotion and building strengths and well-being and competencies and skills that help buffer stress and life events and contribute to preventing problems in the long run. So it wasn't a big shift for me
Hmm.
to go from a clinical background into prevention science.
Well, we're happy you made that shift. When you look back on the field, particularly in working with families, and also from even from your own research, what were the most fascinating or surprising outcome that you made or seen? And positive or negative. It could be a good thing, could be bad things also. I mean, I think you've
Yeah.
seen a lot with families. Um,
I think you do see a lot with families, and I'll say a couple of things. One is there was always a concern that family interventions would just strengthen families that already had a very strong foundation. So this idea that interventions would just make the strong stronger and wouldn't really help those who needed it most. And I think that has been debunked, I guess is the word that we use these
yeah.
days. But evidence really shows that interventions work across the spectrum. So families that need them most benefit from them. In fact, they may benefit from them the most.
Hmm.
So that's one really important finding. I think another important finding that I've seen is that brief interventions can work and can work very well. So there's an intervention that was developed by Tom DeShawn and his team called the Family Checkup that is done in really 3 brief,
Mhm.
semi-brief sessions, and families benefit from that a great deal. Going through an assessment, getting feedback about their functioning, and then being also referred to resources if they need it. And just going through that 3-session family checkup can have really profound effects on how parents and youth conceptualize their family, think about their family, and make particular changes. So I think the brevity of interventions is also an important thing that we've learned a lot about. And the third finding that I think is absolutely fascinating is that in one of our large-scale interventions called the Prosper Project that was done in Iowa and done in Pennsylvania, and I actually had some interaction with that when I was at Penn State. But the Prosper Project intervened at a community level. And what they found in their communities was that only about 17% on average of families who were eligible to go through a family intervention went through a family intervention. So you didn't get a high degree of saturation of families going through the intervention, but still you had community level effects on parenting characteristics. So this was a randomized controlled trial where communities were assigned to intervention or not. Certain communities would receive a family intervention. 17% of the eligible families would receive that intervention, but then you would see community level effects. There's some kind of a ripple effect that's happening within those communities. We don't understand it very well, but it's fascinating. And I think we can think about contagion and different kinds of effects that can be really useful. So.
Well, people don't live, particularly families, parents don't live in a bubble. They talk to their friends share their problems, and in a way, they become emissaries of the information that's been passed on. So I think
so. And
we really haven't investigated very well.
And one of the reasons that fascinates me the most is because I used to tell all of my students, all of my classes, that parenting was something that you tended not to ask questions about outside of your family, your mom. If you had questions about how to raise your son, like I did, I talked to my mom and I talked to my dad. I didn't knock on the neighbor's door and say, "Hey, I'm having this challenge with my teen. What did you do?" But I think that there are informal networks that we learn a lot about parenting and families through.
I think that's very true.
Doug, one of the things, and connecting a little bit to that, I mean, and the percentage of the actual families that engaged into programs, and one of the questions that we do get a lot during trainings is, and in any session about families, how do you get families involved? I mean, because it's one of the biggest challenges, having them or getting them involved in an intervention, in a program that they can actually be part of, but they're not going. So what are the things that can be done in those terms?
So that's a really great question, because parents seek out intervention when things are really bad. So oftentimes parents have a very high tolerance for disruption in their family, right? And they won't seek out the kinds of learning that can help them as they transition through different phases of being a parent. Except if you go to Barnes and Noble or a bookstore, they still have these brick and mortar bookstores where you can actually go in and look at books instead of online. But if you go there and you look at parenting, there are tons and tons of books about parenting. Most of them have to do with how do I parent to keep my kid from being a bad kid, or what do I do when I see this? If you look at the very early parenting books, pregnancy books, they're much more positive. They're much more about how to be healthy and how to promote development positively. And I think we get a little bit off that developmental line as our kids grow a little bit. And parents don't have a framework for, it's okay for me to not know what an 8-year-old is going to be like, and how do I parent an 8-year-old? So parents don't naturally go to these kinds of family strengthening programs. So I think those family programs have to meet parents where they are. They have to do a little bit of educating, and they have to find critical transition points that are leverage points for parents' understanding and learning. We found that the transition into middle school was a great opportunity. Parents have been in elementary school contexts where there's one teacher. They have they can build a relationship with that teacher. And then their son or daughter is going into 6th grade, and they'll have 7 teachers, and they're going to this big, scary, unstructured place. And parents aren't quite sure how they can handle that. Parents also have a mindset of, oh no, they're going to become an adolescent. And everything that adolescence can bring with it. Sometimes parents are doing their own little projection of what their adolescence was like, and they don't want their son or daughter's adolescence to be the same. Sometimes it's a realistic view. They're living in a situation where the schools aren't great, the neighborhoods aren't great, and they need a little bit more support. Those leverage points are opportunities to draw parents into these kinds of interventions and meeting the parents again where they are. I think another element of engaging parents is through the parents' experience and mapping onto their experience what the intervention is going to be like. In some of our work, the first thing we did with parents was to get them to understand that we recognize it's hard being a parent and it's stressful being a parent, and our work with them was going to be as much about them and their experience as it is about their child. So parents engage in these programs, they think that you're using me to help my child instead of personalizing it for the parents. So
Yeah.
some of those kinds of things can be really useful in connecting to the parents at the very early stage.
Thank you, Doug. Going back a little bit into history and your history also with the Universal Prevention Curriculum and APSI, back in 2013, when Zilly called you and asked you to be part of the developing team, why did you say yes?
Because I love Zilly.
We all love Zilly.
Number one, I love Zilly. Number two, it didn't take a lot of convincing for me to really get on board, because I saw how useful this could be. You know, I'm a researcher, but I'm also an educator. I knew that prevention science wasn't really an area that that had a way of educating the practitioners or the next the next round of people who were going to be selecting and doing the research, and particularly in communities. So it wasn't hard for her to convince me that this was a noble effort and a really useful thing to be done. But I do remember our first meeting, we were going to do the whole thing in a week, right? And so the whole program was going to be a week. And it's grown and grown and grown because we were underestimating what we needed to be able to teach people. And so, yeah, I think back on that phone call sometimes, Zilly, and I'm really grateful that you reached out to me. It's a wonderful opportunity, and I'm really happy to be part of it.
You're very grateful that you joined us and struggled with us. You've always kept your sense of humor. It was always good.
So, of course, I'm not going to ask you what your focus on UPC was, because it's families, of course, and then came the training and bringing these to all over the world. I have been honored to be able to train with you, and we've been everywhere. I mean, in Thailand, Brazil, Latin America, here in the United States. And I do have a lot of memories and a lot of anecdotes to tell, but there's one that struck me a lot, and that one, and I think you know what it is. It's when we were in Utah last year, somebody asked you, excuse me, what do you know about the Mindfulness Enhanced Strengthening Families program? And then you said to her, I developed it. She almost fell off her chair, as other people in the room. So, how did you feel in that moment? Like, what can you share about that moment in particular for you? How was that for you?
Well, it surprised me because that program isn't widely distributed. It's not super well known yet, but so it surprised me in that regard. But it also, I felt honored that that somebody had recognized that and had been interested enough to ask about that program. And I felt confident that I could respond to her questions about it. But it felt really, it felt good that I could bring that to somebody who wanted to learn more about that program. And I was right there with her in the session, and we could have that kind of conversation about the program from a level of understanding, at a very basic level of understanding, not just I've read about this program and I understand it intellectually, but from the struggles that I went through in that program with my colleagues Mark Greenberg and Larissa Duncan and the Virginia Molgard, who wrote the Strengthening Families program. All of the ways that we went through thinking about that, and Elaine Barrera, Barrena, who all of this team brought so much together to create that program. And I could talk with these students about that level of programming. And I think that was special, a special time to teach and learn.
And then in the Implementer series, you actually build a part of mindfulness within the curriculum, because I mean, I think it's a very good skill for prevention professionals to have as well. So that's really great when you build that piece in.
I think so. I think so too. And I think that also, Zelia, is an understudied area of implementation science. So we build these curricula and we say we can deliver these curricula, but not everyone delivers the curriculum the same way. And I think we need to understand that. And my belief is that a facilitator who has social emotional learning skills, including a sense of mindfulness and presence, delivers it in a different way and a more compelling way. And so for the Implementer series, training implementers in just a little bit of that, I think helps with their understanding of how to facilitate.
You know, I think your distinction about the intellectual, you can intellectually understand how a program is designed and how it's developed and how it should be delivered. But you're right, that special connecting the information to the audience, I think is, I don't even know how you teach that, but certainly mindfulness is a step in the right direction for doing that. Absolutely.
Yeah, we say in our mindfulness enhanced strengthening families program 10 to 14, we say that the facilitators have to embody the teachings. So they have to be able to, when you're teaching parents to be present and calm, you have to be present and calm. It's the only way. And so I think that's the kind of experience we were hoping to give the facilitator, the implementers in the training.
And I think that your work in being in the clinical area helps a lot in that regard. Some of those skills that you learned during that time.
I think the clinical and a lot of personal practice and reflection.
Especially raising children of your own, right? Talk about mindfulness.
my two boys have been my best teachers, no doubt. Absolutely, no doubt.
I think we learn from our children.
I think that's one of the most fascinating parts of doing the family prevention and working in prevention, because you're you're in both places. I mean, you are doing
Yeah.
prevention, but then you can apply it on, I mean, for yourself and your families. Doug, is there any memory or anecdote or anything that you remember in this whole world of UPC and trainings that you remember that you can tell us?
Wow. Wow, it's just it's I mean, there's so many, but I think what a memory that really resonates with me is the um, graduation ceremony in Bangkok, where we had, I don't know how many, we were delivering multiple um, sessions, and so the school and the workplace and the family and so there were many students, and um, and just seeing the excitement in their, well, the way they walked up to get their to get their certificate, the joy they had in completing it and being through it, and the sense of accomplishment they had, and the excitement they had in thinking about they're going to take that back to their country, and they're going to begin to implement these things that they just learned. Just that whole atmosphere, I think, will always have a really strong place in my heart when I think about APSI, because it's what we wanted to do, right? It's
Yes.
what we wanted to teach, and we wanted to inspire, and there it was right in front of us. That's what was happening.
Yeah, it was amazing. It is amazing. All the trainings we've been doing, is every time, every group has just brought something different to the training experience that we learn a great deal also from that experience. So yeah, no, it's been
And
quite
then
a
you
lot.
see, sorry to interrupt, and then you see things being done in those countries.
Mm-hmm.
Um,
Yes.
and that's what's really, well, that's why we're doing it, right?
Yeah.
That's why we're doing it.
We're staying in touch with many of the people we've trained, helping them, because many of them are in positions where they can make a difference
Yeah.
in terms of prevention. So it's an amazing thing to happen to one in their lifetime.
It's
It really has been
fantastic. It
incredible.
really is.
Can I bring you back to today?
Yeah.
In the COVID situation, because I'm sure many people who are listening to us today are parents, and many of them, um, they're at home, and the whole dynamic parenting is quite different, and there's stresses. I mean, we know there are stresses because of childcare, loss of jobs, people who in the family are sick.
Yeah.
I don't know if this, what can you say to the audience about that situation? And obviously the whole mindfulness thing is tough to do when you're under a lot of stress.
It is. It's also the best time to do it.
Yes, exactly.
So it's the hardest, but if you can just shift out of that craziness for 10 seconds and take a step back and breathe for 10 seconds, you can regain a little bit of a perspective. But our lives have just been turned upside down. And the first thing I say to parents is, it's okay to feel uncertain. It's okay to be anxious. It's okay to not know. And it's okay to not do as well. We've been in these these routines, and those routines have been shattered, and maybe our response was, well, we got to get back into another routine. And routines are great. Routines are terrific to give us structure and help us move along. But um, it routines are generally built up over a period of time. We learn what works, and we change those routines as our kids are growing, and we get into a rhythm and a structure of our family lives, and then it crashes, and it's not easy to immediately get into a new routine. So I tell parents, give yourselves a break. Give yourselves a break. We know that you're doing the best. We know that you're trying to manage what you can manage, and take care of yourself. So there's a saying in the mindfulness community and whatnot, that you have to put your gas mask on first, right? And there's a reason why they say that in airplanes, right? You got to take care of yourself, and that means if that means every evening you need to go for a walk and get out and about, try and make sure that you're doing that. Try and monitor your own health and well-being and sanity, I guess, in some way, and do those little things that are good for you, a long bath or a walk or something. And then recognize that we're in a very odd time, and recognize that kids, if you have children are very resilient. And if you are staying connected with them and showing, like the Strengthening Families 10 to 14, love and limits, not letting them get too out of hand, and showing them that you love them, your family's going to get through this. I also talk to parents about structuring in terms of what they're exposing their family and their kids to. As much as we might, as adults, want to turn on the television and understand what's happening and get an intellectual understanding of COVID-19 and what's happening in our communities and in our world, kids aren't interested in that. Most kids aren't interested in that, right? And they feel it through your experience. So if you can separate yourself from that, find a little bit of time if you need to tune into it, but don't have the television on in the background all the time, and try and focus in on the moment of being there with your kids. Play games, play board games, do things and activities that bring you and your kids joy together, and maintain that connection. Share your emotions. If you have a family member who is sick or has been exposed, don't hide your emotions. Be forthright and use it as an opportunity to teach your kids about their emotions, and about how to manage their emotions and how to share their emotions. A lot of families have been devastated by this, and we can't hide that from the rest of our family members. And we have to be able to share the emotion and share the grieving, and participate in that with your children if they're grieving too, and help them understand that that they can move through that process too.
Wonderful. Thank you. Thank you very much, Dar. I think that's very helpful advice. Maria?
Absolutely. I guess we've got a lot from you, Doug, and we thank you for being with us today. And I'm really excited because we're going to have a prevention talk about all these things, and that's going to be live. It's going to come soon.
Great.
And we'll plan for that. And thank you again for joining us. This has been great. Really, thank you very much.
You're very welcome. Thanks for having me. I know this was supposed to be about half the amount of time, but you know, you just turn the switch on and I'll get going. And I love talking to the two of you. So it's just
we enjoy it. We enjoy you too. And I think this is great advice, and for our listeners too, the parents in the audience. I think it's going to be really important for them to hear.
They and anybody who needs can contact me. So I'm on the website at University of Tennessee College of Social Work, and happy to correspond with anybody who needs.
Thanks again, Doug.
Thank you very much,
All
Doug.
right.
Take care.
Bye-bye.
Bye.
Bye, everybody.
Bye.
Bye.